Joining me now from Atlanta is Bloomberg News senior editor for healthcare, Drew Armstrong. Drew, thanks for being here. I want to start with the lack of administered vaccines, despite 15 million being distributed. What's slowing this process, and will threats like those made by New York Governor Andrew Cuomo of fines for public and private hospitals if they don't administer doses within a week of getting them, will that help move things along?
Yeah, it's very interesting. You mentioned some of the top line numbers that I think are really important. We know that they're being distributed out, but clearly they're not getting into people's arms as quickly as they need to. We've seen states respond in a number of ways to that. Some states like Florida and Texas have begun to open up their vaccination programs to people in phase 1B. And the result is that because it appears that they were not fully organized and ready to do so, you have these massive lines, people trying to sign up, and signups being shut out like trying to get a ticket to the Rolling Stones in a tiny club or something like that. In other cases, you see stuff like New York where the governor has basically said you have to use all your vaccines in a week or you're in trouble, and then at the same time said if you give the vaccine to anybody who's not supposed to get it out of order, we're going to fine you and put other serious penalties on you. So I mean, if you're actually trying to do this on the ground, things are very, very complicated and messy. I mean, was always going to be an immense logistical challenge, an operational challenge to do this effectively and do this quickly. And I think we're seeing some of the cracks in that begin to show.
Are we going to start seeing this improve soon, or is this sort of a harbinger of the next few months? Does it seem like states in general are making the changes necessary to clean this up and get these vaccines distributed?
Yeah, I think that the next couple of weeks are probably the best place where we can really get an honest assessment of how things are going. This started in the middle, and I don't say this to make excuses, but this started in the middle of the holiday period. The data have been messy throughout the holidays, difficult to get people lined up. Healthcare systems have already been pretty stretched. We're now in January, there's not really any more excuses. Everyone's had a few weeks to get their systems up and running and figure out how this is supposed to work. And you don't have any issues around holidays, all of the kind of startup pains. I think, those are no longer really an excuse. And the next week or two is really when I would look very closely at the numbers to determine, is this working or is this not?
So there are a handful of states in the Bloomberg vaccine tracker that you and your team have worked so hard on building that are doing better than others. They include North Dakota, South Dakota, West Virginia, Maine, Vermont, Tennessee is in there as well. Is there a common thread, Drew, that runs through these states that are having a better response than others?
It's a really great question. And as far as we can tell, no. There seem to be some independent reasons for each place. West Virginia, for example, they did not participate in the federal program of getting, using the federal system to go into nursing homes. And they went and started their nursing home vaccination program themselves, which is why they have done particularly well. But no, I mean, you look at what's happening here. This crosses every kind of assumption that you would have necessarily about how this would be going. I mean, I would say maybe the one consistent thing is that none of the states that seem to be doing relatively well are particularly large, but you still have some sizable states. I mean, Connecticut, Tennessee, that are doing quite well in terms of their percentage of shots used. I don't think we have an answer yet on it being one specific thing that's going right. Some of this is just going to come down to execution competence. What
about internationally? And we look at the map that your team has been working on. Israel really stands out as a country in the world that seems to be doing things right. Yes, it's a very small country. It has a fraction of the population of even like the state of California, for example. But still, the country's managed to vaccinate more than 13.5% of its population already. What lesson does Israel offer the rest of the world?
I don't know, how much you can really take away from, Israel and then, for example, Bahrain. Israel, small country, mandatory government service for much of the population, just totally different healthcare system than the United States. There almost certainly will be lessons to extract from how these things are done. And I know that there's been a lot of attention paid to, should we delay doses, all of those things. Every country is dealing with a somewhat unique set of circumstances, and some of the lessons that are going to be lessons to extract are going to be about what type of healthcare system have you built in a much bigger sense, not necessarily what is your vaccine administration, because everybody is starting from scratch more or less on the vaccine administration. Some of it is going to come down to what is your infrastructure and governmental capacity heading into that.